My name is Dana Colvin. I'm a wife and a mother to two beautiful children. My daughter Alexa is 3.5 and my son Cameron is 1.5. I'm also a full-time nurse at a hospital. I work in the acute care float pool. We do everything from pediatrics to psychiatry, postpartum, post-surgical, and telemetry. So between work and the kids and my husband and the housework, it definitely is a very, very busy life. I recently decided to become ANCC board certified in medical surgical nursing. Diane McFarland is a mentor to me. She is my immediate supervisor, but also a friend, and she is herself ANCC certified, and she encouraged me to become certified in a specialty myself.
Dana is one of the nurses in the acute care float pool, which directly reports to me in the organization. I highly encourage the nurses to get certified. I think that it really is that final seal, that validation of the excellent care that they provide every day in and out to the patients.
There's a major issue, a major emphasis on quality patient care these days, at the national level all the way down to the local hospital level. And certification is a means by which we use to measure competency and assure our patients and our clients that we're delivering good quality care.
We don't require nurses to be certified to work at our organization, but when I'm hiring a nurse, I do look for that certification.
I believe the number one reason that a nurse ought to be certified is the personal and professional value that that individual places on the commitment to practice. And committed individuals generally do seek a higher level of excellence.
Diane encouraged us to go on the ANCC website and find out some information about becoming certified.
I recommend certification through ANCC because being an affiliate of the American Nurses Association, they really are getting certified at the top pinnacle, that organization that really is the creme de la creme of certifying bodies.
We know that their exams have passed rigorous psychometric analysis so that it is truly measuring what it says it's measuring. It's got validity and reliability.
The American Nurses Credentialing Center is the largest and most prestigious credentialing organization in the world. We have 25 certification exams in a variety of specialties, and we have a long history of high quality in certification.
We know at ANCC how busy nurses are these days, and it is often difficult for them to find time to do extra things such as take a certification exam. So we do everything possible to try to make it as easy as we can for them.
I went on the ANCC website and printed out the outline of the most likely questions there would be on the exam. Then I bought a review course book and studied from that. I also took a med-surg review course.
ANCC does a great job of preparing candidates for the certification exams. They offer a wide variety of seminars throughout the United States, and the candidate has an opportunity to review what's on the exam, the content, and to have their questions answered by an ANCC staff member.
They have online study groups that they just started, which is very exciting.
We try to make the process for certification as convenient and easy as possible. We have online materials, online applications. We test at over 300 centers in the U.S. that are open 7 days a week and extended hours.
When I was ready to take the exam, ANCC made it very easy. All I had to do was go online, punch in my zip code, and they told me a whole list of testing sites that were near me. I felt very confident going into the exam. Between the test content outline on the ANCC website, the review book, and the review course I took, I felt all covered the content that was actually on the exam itself.
Welcome to Prometric.
When you arrive at the testing center, they give you a locker to put your things in. Then they escort you into the testing area. Then they give you a 15-minute tutorial of how to go through the computerized exam. When that's completed, the test starts. They give you 3.5 hours to complete 175 questions. The questions that were coming up, I knew the answers to. It made me feel very validated that I had studied the information that was actually on the test. And then you come out and they give you the results right then. You don't have to wait. They told me that I passed and I felt very, very excited. Very, very happy. I called Diane first thing when I got back to work.
When Dana first came back from being certified, she certainly was, elated about it. It was a very exciting time for her, and we were all very happy. But what I have seen is that her level of professionalism, just where she looks at nursing now, has grown. She always has been a wonderful nurse, but now she's really looking at, well, what can I do to make the unit and to make the profession better?
Nurses sometimes get stuck in their routine about the way they do certain things in their practice. Certification is a means by which they can look at innovation, look at new ways of doing things, best practices, and then they often bring that back to their practice.
They have better tuned critical thinking skills, and they work much more collaboratively with the administrative team as well as the interdisciplinary team. I think they've gone a long way in elevating the level of safety that we provide within our organization.
It's a lifelong process of learning, and certification often is at the root of that learning process.
When the patients see my badge with BC after it, which stands for Board Certified, they usually comment and ask what it stands for, and when I tell them, you can tell that they're impressed, and it does make a difference in how they perceive you. They figure you must know what you're talking about.
I would say to any nurse who asks why they should be certified is we're a profession, and it's our professional obligation to show that we've got the clinical expertise and knowledge to provide safe, evidence-based care to our patients.
I would definitely recommend becoming certified in a specialty to any nurse. It shows that you'll go the extra mile. People think that they don't have the time to study or the time to take the test, and it's really not true. I think in my busy life, working full-time with 2 small children, I think if I can do it, anybody can do it. I actually plan on going back and doing another certification this year, probably in pain management. I've caught the certification bug now.
When I look at nurses like Dana, they really are our nurses of the future. And so we all need to really look at where do we see ourselves going in the future, and where do we see nursing going in the future. And to be able to put ourselves in places so that we're able to give the patients the care that they deserve, but then also to move the profession of nursing on to that next level.
I'm a certified nurse.
I'm a certified nurse.
I'm a certified nurse.
Today I'm very proud to say that I'm an ANCC board certified nurse.